he said when he reached the clinic lobby, the doctor was like waiting at the lobby for him. It was that serious.
Hi everybody and welcome to another episode of
What the Health?
A series on all things health from the perspective of TCM physicians here in Singapore.
My name is Ming.
I'm Kat.
And I'm Zheng Jia. And today we're going to be talking about...
When should we go to a hospital instead of visiting a TCM clinic?
Yeah.
Okay, so why?
Okay, so when in Singapore's context, you have TCM, right? And you have Western medicine.
Abuden.
So sometimes...
You have Ayurvedic medicine too.
The more common ones lah.
Got the jamu also. Hey, why you laugh?
Okay, but then sometimes when you are met with a illness or a sickness, a symptom, sometimes as someone who maybe does not have much experience in the medical field, you might be a bit, as we say, kalang kabut, like you don't really know what to do, right? So if let's say you're someone who is used to seeing a TCM physician, you might think about going to see a TCM physician to resolve your problem. But the problem with this is that sometimes in certain situations where it's a bit more encountering illnesses which are a bit more, life-threatening, immediate life-threatening, right? Then this is not such a good idea, right? Because time-sensitive conditions can, have a very drastic impact on the recovery.
Mm-hmm.
Yeah, so I think that's why it's a topic that we would like to discuss about today, lah.
Okay, so like some examples that you need to go to a hospital is, for example, when you like fracture your body part, or like when you have a stroke, or like when you have like high blood pressure that is like too high. So sometimes when you visit the Western doctor, or like when you go like TCM doctor, if they see like your blood pressure is like 180, 190, 200, right, they won't want to see you. They will just straight away just call ambulance and then just ask you to go to the hospital.
Yeah, correct.
Yeah.
I think it's called a hypertensive crisis. So I think when that happens, it's a medical emergency lah.
Yeah, because you don't know when you will faint, and it might...
Or like it might lead to heart issues or stroke.
Correct.
Yeah, so in such a situations, for example, if let's say you have these kind of symptoms and you decide that, okay, you want to go and try a TCM first, for example, and as a result, maybe you miss a certain critical
golden
window for treatment, or maybe on the way to the TCM or after you see the TCM, something happens to you, which could have been prevented if you went to a hospital straight away. Yeah, so I mean, I guess that's the gist of the episode lah. We will try to maybe pinpoint some of the examples that we ourselves have experienced. Because I myself have seen quite a few cases where it is really an emergency lah, and so we also don't see as physicians, we push it away because I think that is the more ethical and is the safer way to do things in Singapore. Even though we are TCM physicians. So maybe before we carry on, maybe we get our producer over here to share a story. So she has a very personal experience with something related to this topic. So
I think you can just hear her voice, don't see her pretty face.
We don't want to change the camera lah. So we will get her to share her story about her dad and this particular incident that happened.
Oh, everyone's staring at me. I'm stressed. So my dad, he actually had kidney failure a few years back. And then I think at that point of time, he had late stage kidney failure, but he refused to go for dialysis. He refused to accept that
He needs to go for Western treatment.
Yes. My dad is the kind of like the old people, old generation that refuse to go to hospital unless he is like dying lah. But he was dying He still refused to go. So I don't know what's the deal about him, but he refused to go hospital basically. And because he had late stage kidney failure, right? At the point of time, he's having like fluid retention. So for late stage kidney failure patients, they have a few symptoms, and one of them is like fluid retention. It can be on your leg. It can also be like in your lungs. So at that point of time, he actually had it. I think it's called pneumonia, right? Yeah. So he had difficulty breathing because of that. And it was so bad, like he was like
wheezing.
Yeah, he was wheezing already. And he still refused to go to the hospital. Yeah. So and I think I remember that day quite well because I just landed in Singapore and my friend we had like a surprise gathering, and then my mom suddenly just told me to send my dad to the hospital because he can't breathe. But then my dad was very stubborn, so like he told me to send him to a TCM physician. Okay, actually that guy is not a TCM physician. He's not licensed, but he do cupping treatment for people. Yeah, it's quite what do you call that? How do you call it? Dubious, shabby,
Shady.
Yeah, shady is the word. It is a very shady place because it's like at a random coffee shop, right? Then there's this room in the coffee shop, air conditioned room, where that guy perform treatment for people that comes to him. And I think he only do cupping. He doesn't do acupuncture. Yeah, and he's not a licensed physician. He's just a guy that do cupping treatment for random people. I think a friend introed my dad. So my dad went to do cupping with him, and he plays like those. He do vacuum cupping, so it's not those fire cupping. Yeah, like it's the plastic cups one where you suck up the thing. Yeah, so he placed it over my dad's chest, right, and then right after the cupping, he felt better instantly. I'm not really sure what's the theory behind it. I suspect it's because the cupping kind of like increased the space between the lungs, so he can kind of breathe for a moment. Yeah, but right after that, the guy told my dad that he should go and drink more water and have his meal because he haven't eaten yet. So like my dad listens to him, over me. And he went to drink water and he already had fluid retention, right? So right after he had a cup of Milo, he started puking. And then his wheezing got worse lah. So I immediately drove him down to the nearest hospital that I can find, which was Maui at that point of time. And the doctor actually told us that if I send him any later, he might have died. Yeah. So the moral of the story is, like, if you really need to, you have to go lah. Yeah, don't be stubborn lah, because it might have cost your life lah. Yeah.
Yeah, so like this is one story. Also like another story, or like not story, like I'm sure many of us TCM physicians will experience is when people who have like high blood pressure but they refuse to go to the Western doctor to get it checked or like control it with medication, right? So like usually if the blood pressure is too high, sometimes it might cause like stroke or like other complications, which is very dangerous. So usually they will come to like TCM doctor and say, yeah, I want to have medicine to control my high blood pressure. But that is one misconception, that TCM can reduce the high blood pressure. TCM can control the high blood pressure, but it does not solve it. Like, it's not an immediate solution, because TCM drugs takes time to slowly take effect. It's not like Western drugs where like the drug has like rapid or like immediate effects. So like usually this kind, I mean, I as a physician, I will recommend my patients to visit Western doctor to take drugs first, then at the same time combine together with TCM to like manage their bodies. So I think this area is where like a lot of Singaporeans should take note lah, because it's not that TCM like one neng one. Like it cannot solve everything. Sometimes you really need like Western intervention to actually like make yourself feel better.
Yeah, so for high blood pressure, this is something that one of our teachers used to say. So the problem with high blood is not that you have a moderately high blood pressure for a long time. That's not the problem. The problem is if there is a sudden spike in your blood pressure. So for example, if let's say it's moderately high, 140, 150, actually a lot of people, as you age, is actually normal. It's not good, but you can still maintain normal function, and to a certain extent, it's not very dangerous.
Process of aging.
Not saying that you should. It's okay to have it. Yeah, but most people, if they have a moderately high blood pressure, they can still function. But what we worry about is if let's say you're not on any medication, if a particular event that you're stressed or you're angry or you're tired, suddenly your blood pressure shoot up. That's when you can get a lot of these complications, stroke, heart attack. Yeah, so the purpose of taking Western meds is to sort of control that baseline blood pressure so that you are not prone to these kind of spikes. Right, and that is very, very important because once these kind of complications occur, you obviously know the seriousness of things like stroke and heart attack and so on. Yeah, and then TCM role in these kind of contexts is more of to slowly help you to reduce that baseline blood pressure, but also help you to address some of the symptoms that maybe Western medicine cannot address. Yeah, so in that sense, I think it's complementary and especially for more chronic conditions like diabetes, blood pressure, it's not something that I feel that TCM can replace Western medicine, and it's something that is more of a complementary thing lah.
Yeah, I think this is particularly this is particular to Singapore's context where TCM is, like you say, is more of a complementary instead of the main treatment. So as TCM physicians, very rarely will we tell you to stop taking the the Western medication. Yeah, we always use the TCM combination, and then we will maybe slowly wean off the Western medication, see how you respond along the way.
Under the direction of the Western doctor.
Correct. Yes. Yeah. So we will always work hand in hand, but we will never in a way override what the Western doctor says lah when it comes to this kind of chronic conditions. Yeah.
Yeah, so in that regard, you can more or less also tell that in Singapore, or at least in most places, I still feel that Western medicine is still number one in terms of order. If let's say you have something serious, especially if you have something serious,
Yep.
Because as TCM physicians, there's also another misconception where we take your pulse, we see your tongue,
We will know what
we
exactly
will know
is
everything.
happening.
Yeah, we'll know if you have cancer or what. Maybe I'm just not that good yet lah. But
Neither am I.
But I don't think that is something that we should encourage today with modern medicine, where you have your tests, your MRI, everything, which can physically see inside your body. Yeah. So if you are dealing with something that is life-threatening, serious, then definitely go and get it checked out first. So for example, I had like a patient who had like suddenly loss of sensation in the leg. Not suddenly, like gradual loss of sensation in the leg. Very weak. Then cannot walk. Suddenly one day she walking halfway and suddenly fell down. No strength in the legs at all. Then I went to see her. She looks very tired, very weak, very skinny. Then I asked the family member if she has any medical history. They say no, she hasn't been for a medical checkup for 10 over years, 20 over years. So then I got a bit suspicious already lah. So then I said, I don't think that this is a problem that I can solve because I don't think it's a muscular thing. I don't think it's like a circulation thing, right? I suspect that it's something to do with her blood vessels being obstructed.
Like she should just get it checked to see what exactly it is.
So I asked them to go and see a doctor, and true enough, she had diabetes lah. Yeah. So in such a situation, if I were to treat her, she might feel better a bit, but the cause of it is diabetes that is causing her blood vessels to be blocked, right? So in that sense, TCM really there's nothing much we can do in the short term, and especially for something like diabetes where it can lead to a lot of complications. Then I think it's important that you have the Western medicine intervention lah.
Yeah. So I also had this patient who came into the clinic, and then she's a bit more pale. Then she gets bruises very easily. Even like when the 推拿师 press for her, then she will get bruised, that kind. So she comes
red
for like
flag.
very very big red flag. But in TCM, we'll classify this under like 血症 or blood problems. And then one of the 症型 is or the diagnosis, the differential diagnosis is 气不摄血, that kind. Yeah, where you have not enough 气, so you're not able to hold the blood.
Cannot control the
together.
blood.
Cannot control the blood. So it bleed internally very easily. But eventually found out that she had leukemia. Yeah. So if I were to treat her, I might not be able to tell that it is so serious. It's something as serious as leukemia. Yeah. I would just maybe treat in.
Like a blood
maybe
deficiency
补气
or like correct.
Yeah, that kind of thing. 补气 or like boost your blood content or this kind of thing. So she might not, be able to find out that it was something as serious as that. Yeah.
So I mean, in the past, you have to understand that there was really no Western medicine in the past, right? So that's why a lot of these explanations or a lot of these theories that we use as TCM physicians, they are still applicable, but maybe not in an emergency context.
Yeah.
Right. So in a lot of situations, we always say, I think the rule of thumb is if you have a very serious kind of symptom, right, then you go and see a doctor straight away. Or if let's say you've been treating a problem with a TCM physician or with multiple TCM physicians for a particular period of time and you haven't seen improvement or is in fact getting worse, then go and do a check because there might be something physiologically wrong
Or something more sinister.
Yeah, something underlying that is not being picked up just by a physical examination. Yeah, and that's where that's why we say in certain situations, no matter how much you are a believer in TCM, there are situations that call for you to go to hospital lah. Yeah, and I think vice versa as well. I mean, sometimes a lot of patients, they go to hospital, they do all their checks, everything is okay, but they still have that symptom or that pain. In which case, the reverse is true. You can then come to see a TCM.
And then we'll just like tell your body to see
Correct,
like what is exactly wrong with you.
Yeah.
So like there is one very, very, very common thing that people will come and see TCM for, which is for like sprained ankles or like sprained hands or like, you pull your hand muscle after all this. But then there are some situations where like you shouldn't come to us in the first place. It's like, for example, like a very basic ankle sprain, right? But then usually that one you confirm will go TCM first, correct? But then for some people, right, who sprain and then they think there is nothing wrong, but they are unable to walk properly. Like every step that they walk, right, is like knife poking into like your bones, your meat and everything. Those kind is when you shouldn't come to the TCM because you're just wasting your time. Like most of the time, if like you have those kind of like very sharp pain and like you cannot even walk properly, that kind, when you go to a TCM physician, they help you knock here, knock there, then you'll say, I think it's a fracture. You go to the Western to take the X-ray first. Then if it's not a fracture, then you come back. So most of the time it is a fracture lah. So you cannot visit a TCM for that. Because the only thing that TCM can do is to help you to do acupuncture. But like you cannot touch the thing at all. You have to let the Western doctor like do their job. Bow here, bow there into a cast nicely to let the fracture heal properly. Because like for example, if you don't let the broken bones heal properly, right, sometimes when it goes out of place, then your body will like grow out of like proportion also.
Yeah.
Right?
Yeah.
Yeah.
I think another one to look out for is stroke symptoms. So if you're not familiar with stroke symptoms, the common ones is like the face starts to droop, the speech starts to slur, they start to lose mobility on one side of the body, you have sudden loss of consciousness. Yeah, if you have such a situation, sometimes it can be confused with something like a facial paralysis, where it's just a local nerve kind of infection or inflammation, which is not as serious. But if you have that facial paralysis along with, half a body paralysis and numbness,
you cannot feel anything.
and suddenly faint or this, then it's likely a stroke. In such a situation that is time sensitive, if you go and find a TCM first, you spend an hour going there. If let's say the TCM physician, goes to do treatment because maybe he doesn't understand the situation as well, you waste another hour. You can really miss the opportunity lah. Yeah, I have a patient like that, and then the husband didn't know what to do, called the son. The son took a long time to come. Then eventually when they got to the hospital, it was like 4 or 5 hours later. Yeah, and then by then the brain capacity of the patient was very badly affected already lah. And then after that became bedridden and very sad lah. Yeah, so in any case, the reminder is always, if you don't know what to do, just go hospital first lah. Yeah, don't go and try your luck, I would say.
Yeah.
Try your luck.
Yeah, I think at the end of it is clarity. Yeah, having a clear understanding of what you're suffering from. If it's something very basic, like maybe a bit of a neck sprain or your wrist sprain, something less
Severe.
severe, sure, you might want to try TCM first. But if it's, let's say, it's really causing you a lot of discomfort, a lot of weird symptoms, specifically if it's weird symptoms, I think maybe it's best to get it checked out first. Be clear of what we are dealing with, and then you can consider options, whether you want to go with the Western route or you want to go with the TCM route or anything else.
Yeah, but it is ultimately it's important to get like a proper diagnosis for like what are the causes of your weird symptoms before you come and visit to the TCM. physician lah. Also, because like Western medicine also like because their drugs has like rapid and like immediate effects, unlike TCM medicine.
Yep.
Right.
I mean, this also leads to one point, which is that a lot of elderly sometimes they don't want to go for their checkups, right? So sometimes maybe it's not something that is symptomatic, but it's something that's underlying that you can actually detect with regular checkups, right? In which case, we also want to reiterate the importance of going for
annual health
checkups, even though it may not be able to detect maybe something a bit more rare or unusual. But at least for the general basic stuff like high blood, diabetes, you can detect.
Cholesterol.
Yeah, and then by detecting, you are sort of preventing. Because if you are able to take the medicine, and then if you want to go and seek TCM as a complement, then you can very well maintain these kind of chronic illnesses, and then you don't progress to be in a situation where you need to go and decide whether you want to go to the hospital or not lah.
Yeah.
There's a story that I had a friend who, not really a friend of a friend lah. So basically, he's 30, I think. He went for annual checkup. The company sponsor lah. So, he go, then after that, the doctor say, okay, out of these tests, there's a lot that is given basic one. But then you can choose one extra one. It's part of the package. So he chose. He asked the doctor, what do females normally do? Females normally do like ovary, the womb, cervical checks, right? So he said, is there anything specific for guys? So the doctor say can do for testes. Just check lah. Then he said, okay lah, never mind, just check lah. Yeah. And then check the next day or the week or so, something like that. The doctor suddenly called him. Then the doctor say, hey, you need to come in now. Like you need to come in now. Then he say, there's something that we need to tell you. Yeah. Then he said when he reached the clinic lobby, the doctor was like waiting at the lobby for him. It was that serious. Then after that, not even like in the room, Yeah. So he found out that he basically had testes cancer, stage 1. Yeah. But he had no symptoms at all, right? I think he said maybe he felt like his testes was a bit big, something like that. Yeah. Right. So when I heard it, I was like, wow, I was shook lah. Like really, like he had the luckiest set of cards. Yeah. Right. I mean, if he
delayed,
had that check, if he didn't choose that, even if he didn't choose that particular test to do, he would never have be able to detect unless it progressed into something a bit more symptomatic lah. Yeah. So I mean, unfortunately, your regular health checkup sometimes they don't pick up a lot of things like cancer, for instance. But at least you are able to safeguard yourself against some basic things. And the remainder, you just have to be more aware of your body. If anything is wrong, then you just go and check.
Yeah. Also, request to all companies to have regular annual health checks. Include everything.
Basic. Like
basic.
those blood
At least
tests.
Basic,
I think because one barrier of entry is also expensive. And then if you're not covered, it's like, I feel good. Then why am I going to spend the money to go and check?
Yeah,
especially if you're young 30s, like ourselves. It's really like we like.
Yeah, like you'll feel nothing lah, but it's still very important.
There's no 推动力. There's no motivation at all to go and do it. It's like you're just throwing money away.
But you need to remember that nowadays younger and younger people are like getting high cholesterol or like even like diabetes. So because diabetes has a lot of like side effects and complications, so if you do not control it or you do not like find it early, then like maybe it will affect your feet or your kidneys and everything. So okay lah, health checkup very important.
Yeah. So I mean, this is also for like kids. I think the younger generation are more open like to doing these kind of checks, but maybe some of the older generation very stubborn, right? We have I myself have encountered a lot of patients. I also don't want to go to hospital. Then they will call you. Then they say, I know that this is serious, but need to
I don't want to go to the hospital. I need your help.
My mother or father really don't want to go to hospital. Can you do something or not? But you know, a lot of times these kind of situations, like what we explained in the past few minutes, right, is like there's nothing really we can do. You need to sort of like the person arm severed already. You need to stop the bleeding first, before you can repair the hand, right? It cannot be the thing bleeding, then you try to sew. You know what I mean, So try to convince your parents if you can. My own mother is also very stubborn, I guess we understand also that sometimes it's quite scary to go and check, especially if you're older, right? And if you're someone who's a bit more anxious personality, you're very scared. Oh, if I get something wrong, but then you don't think of like the repercussions that if you don't,
even worse things will happen
what
to you.
can happen, right? And a lot of times, I mean, obviously the family member, the patient who is suffering will suffer the most, definitely. But the family members will also suffer if you, let's say, you sort of don't manage to detect something which you could have earlier.
I have a patient that once called me at 3 a.m. in the morning, say, my mom, the family, my mom is having stomach pain and she doesn't want to go to the hospital. Can you come and visit? Can you come for a house call now? 3 a.m. in the morning. Then I said, this one you should go and visit the doctor. She just called. Then she said, no, can you please come? Of course not right? I mean, as like my responsibility, I will just tell you to go to the hospital to get it checked, right?
Yeah.
What if something happens?
Yeah. What if it's like bleeding, internal bleeding?
Yeah, I have this patient also, really bleeding.
Really bleeding.
Like there's this condition, I can't remember what it's called, the artery block. There's this stomach artery here. Then apparently it's very, very thin, right?
Yeah.
Then like there's a blood clot, then it bursts. Yeah, then the patient, like his whole here was bleeding. Then he felt a bit like stomach pain. Then like it felt very funny. Then it got worse and worse and worse. Yeah. Then luckily the son like was smart enough to go and see a doctor. Yeah. Okay. It's really like the whole when he arrived at the hospital, everything was big and there was blood everywhere. And then the doctor said, you would have died. He would have died.
Okay. Wow. Yeah. Okay.
So a lot of you don't think it'll happen to you but you really never know.
Yeah. Better to be safe than sorry.
Better be safe than sorry, and I guess that's the point of this episode.
All right. So the TRDR, just get it checked. If you feel anything that's uncomfortable.
Don't scared like to look swaku or like don't scared to look like a fool lah. Yeah. It's really better be safe than sorry.
Okay, then we'll see you next week.
Okay. Bye-bye.